Hello, and welcome to another episode of Real Talk on Renal Cancer. My name is Laura Esfeller, and this is the monthly podcast hosted by the Judy Nicholson Kidney Cancer Foundation. We have gracious support from Exelixis, Ipsen, and Merck. Excited to have Jayla Barnes with us. Know a lot of you may be familiar with Jayla, but welcome to the podcast, Jayla. I'm so excited to have you with us.
Thank you so much. It's a pleasure to be here. Thank you.
So Jayla, like I said, I know that you host Pull Up a Chair for us for Judy Nicholson Foundation, but what got you interested into serving the foundation? How did you get started with us?
So a few years ago, I'm a nurse practitioner by profession. And so the healthcare system has been something that's been near and dear to my heart for many years. I've got 20 plus years under my belt. And through an encounter with one of the previous foundation members, he's not with the organization now, but we had a chance encounter, and he asked me to come and do an in-service about cancer in general, kidney cancer. And then, of course, my specialty is hospice and palliative care. And so what we ended up doing was just striking up a lot of really good conversation. And as a result, we had recurring encounters, so much so to the point that I was asked to join the board and now serve as one of our vice president members of the board member. So it's a great opportunity to be with the Judy Nicholson Foundation and to support caregivers, because a lot of the information is always directed towards the patient, but the family is definitely an extension. So we want to make sure we cover all bases.
Yeah, I love that. Thank you, Jayla. And I'm impressed that you started your career when you were 14, clearly. So
what can I say? Like, yeah, sure.
A real life Judy
goodness.
out there. No, that's wonderful. And, I love that, at the foundation, we also encourage support and offer support for caregivers. I think I've talked about this on the podcast before, but in addition to being a patient, I was a caregiver for my mom who had kidney cancer as well. So I've been on both sides of the fence, and I often say that being a caregiver was honestly harder in many ways. I think it was the hardest for me, as opposed to my own kidney cancer journey, which was no walk in the park. So I think it's wonderful that we provide support for caregivers, because it truly is a family disease, or it's a communal disease, right? It's not something that just impacts the patient.
Right. Everybody's life changes to some extent. And sometimes caregivers feel guilty for acknowledging that their life and normalcy has been impacted because they're not the one going through the disease itself. But it's that fine line of owning the right to feel the way you feel and embracing that.
Absolutely. What are some common issues or concerns that you see caregivers come with to you, whether through the talks that you do monthly with us or, in your own practice? What are some things that you typically hear from caregivers that they struggle with or just want to know more about whenever they are, especially if they're early on in the kidney cancer diagnosis?
I think one of the most common things that we find is almost a realization or having to help the caregiver identify that they are struggling, or their cup is getting empty quickly, because and we always say, if you don't fill your cup, you won't have that energy, that compassion. Compassion fatigue is a real thing, and you can be so focused on caring for others, especially your loved one dealing with cancer, that you feel okay putting yourself on the back burner because surely they have something more pressing that is needed. But one of my first questions is, if you fall sick or can't fulfill the duties you have, who will pick up that responsibility and that care? And sometimes that's the aha moment that some caregivers need. So I think the first and most common thing is, well, how do I find the time? They've gotten so used to schedules and appointments and medicine and sleep cycles, and he can eat this week and next week he can. And it's such a changing, it's such an ebb and flow of from one day to the next, sometimes hour by hour in the day, that really just giving them that permission to step away
Yeah.
and not feel guilty about it, to know that
Mhm.
they need it and that they have to give themselves that time to be able to recharge, and I say feel everything that they're feeling so that they
Right.
can own it, identify it, and then possibly do something about it.
I think that's so incredibly important because,
Yeah.
one thing that I know was hard to your point, and I know a lot of us are diagnosed in the ER, right? Or just incidental finding. And
Correct.
so your world is just completely turned upside down. And I know for me, and I consider myself to be a pretty strong person mentally, I
Sure.
was just like out of it for
Lord.
probably a month, maybe longer,
Yeah.
right? Like
Yeah.
I couldn't make decisions, I couldn't function. I just was trying to
It's
process,
shocking.
yeah, right? Like,
It's a shock.
right. And so, that burden really does fall on the caregiver to
Mhm.
be the one saying, not only helping you navigate this complex and medical environment, right, which most of us don't have experience in prior to a diagnosis,
Right.
but also just the simple things like who's going to cook dinner? Who's
Yeah.
going to make sure that the
Right.
light bill gets paid, right?
Right, right, and depending on who is the, affected or the ill, the ill person, is it the spouse, the mother, the child,
Right,
who depending on who that person was and what their role identity is and was in the family, because that transition is also something to adjust to, and then to try and how do you realign or reassign those duties and responsibilities that have to be done
right,
without taking away the identity of the patient, in those moments, but then as a caregiver too, not then adding more on your plate as opposed to really looking at friends and family who always say, "Tell me if you need anything, tell me if you need anything." And it's so hard to
right,
pick and choose. Everybody thinks that it has to be the hands-on care that they're asked that that person is referring to. But no, it may be something as simple as every Thursday, can you come pull this trash from the garage to the end of the road? Like I mean,
right.
it can be a number of things. Can you help with, picking up the kids from school and doing drop off to extracurricular activities? It doesn't necessarily have to be the hands-on care with the loved one or the patient who's going through, because that can be a very private personal moment, but these other tasks can be reassigned.
Yeah. I'm so glad that you mentioned that because that was something that I actually have had this conversation, interesting enough, with two people in the last couple of weeks separately, right? That they found out I'm
Hmm.
a cancer survivor and they're like, hey, I have, when one case it was a family friend, and the other case it was a loved one that's been recently diagnosed. I want to help, but and I want to say the wrong thing, right? I want to help, I want to say the wrong thing. I actually said, try to find something that you can specifically do. Like rather than saying the general, let me know if you need anything, offer
Uh-huh.
specifically, hey, I can drop off groceries on Thursday, right? Or
Correct.
I can send you a gift card for Grubhub or something, right?
Yes.
It's
Yes.
also just that fatigue to your point of now I have to decide what I want you to do. And for a lot of
And
us,
dinner, I've got to decide dinner. I've got to cook dinner. I haven't had time to go to the
right.
grocery store. Yeah,
Right. And a lot of us aren't, or I think a lot of us, and maybe you can tell me if I'm wrong, because I might be, but I feel like a lot of us aren't also great at accepting help, like, right? That's pretty common to not,
absolutely.
right.
Absolutely.
Yeah,
Patient and caregivers alike. Sometimes accepting help feels like I'm already acknowledging that I'm overwhelmed, as opposed to
right.
accepting the help so that you don't get overwhelmed. Or for the patient, it's accepting help, meaning that I can't do it. And so it's control becomes a really big thing for patients,
Yeah,
because here you are, your health is being compromised, and you're either hearing the doctor say your body won't do this or isn't doing this, and you can't control that, or they're giving you feedback on whether a medication or treatment regimen is working or it is not. You can't control that. So then the more those things start to feel more fragmented and that control feels like it's fleeting, then you find yourselves, patients tend to feel, and sometimes it comes out in frustration and or anger where they feel as though their options are being taken away. And
Right.
as opposed to identifying an A and B for whatever the question is, the meal planning is, things that still give them some options as opposed to, which is why I love you were talking about Grubhub, gift cards, things of that nature, so that you can kind of pick and choose and still have options without feeling obligated to go in and cook the meal and
Right.
things of that nature that just may feel even more daunting and exhausting, quite frankly. But you still want to make sure you and the loved one, both caregiver and patient, are eating and getting the rest and the sleep, all the things that are super important for the healing process, but also to keep that caregiver healthy and able to meet those day-to-day demands.
Yeah,
It's a
absolutely.
lot.
It is a lot, I know for me, it was just, again, such a struggle to ask for help and then to accept the
Hmm.
help. And eventually I got
Hmm.
over it. But I do like what you said about the lack of control that you feel as a patient. And I think that it's fair to say the lack of control that you feel as a caregiver. I know for me, that was a lot of it whenever I was,
Oh,
with
yes.
a caregiver for my mom was, I was already familiar with kidney cancer at that point. I'd already been diagnosed myself and I was already in treatment myself. But then I'm reading the scan reports and going, oh my gosh, I know what's coming. I have no control over it. And so how does someone that's a control freak like me manage that? This might be a personal question for me, actually.
Right. What you say? Ooh, this is what you said. It hits home, right?
Yeah, right.
Um, but control is one of those things. It's almost like I have families or patients will say, I hope this test is negative, and I hope this tumor is shrink. And I say to my patients, it's okay to continue to talk about the things that you want, and are praying for and all of that, because voicing that and/or gathering your pair partners or whatever that's going to look like is important. But when it comes to the control piece, part of what folks who really struggle with the control component is, I only want one option, and a lot of times you set yourselves up for disappointment, not in that it's impossible, but I always say plan A, plan B.
Yes.
I want this, the control part. And actually we were talking in one of the support groups not long ago, and I said, the better we get at giving ourselves an A and B option in any area of our life, not just when you're dealing with illness, when you're fighting with teenagers, when you and your spouse are having conflict, if we can get in the habit of doing a plan A, plan B, it actually decreases disappointment because it at least gives me, I don't have to start from zero from the beginning every time I'm confronting something. So the control part may be, give me a picture of what A looks like, and then give me a picture what B looks like. And that way, as your care team, your caregivers, patient, family, whoever the members are in your circle, as you go through the journey, you're not starting over every time there is a hurdle or a bump in the road, but you're able to say, okay, this is now how we'll navigate.
Right.
And so for the control freak, I say that's one of the things I say, you got to broaden your scope just enough to give yourself permission to have a plan A and a plan B. And neither have to be it's not so much of a positive or negative outcome. It's just, if he offers me this medication, let me get educated and know as much as I need to about that one. Let me find out everything about diet management, all the tools, get the tools in your belt, and then look at, so I want to go in this direction or this. And both can be with the same desired outcome, but just giving yourself two potentially different ways of handling or addressing it. And that way that keeps the control component there, but
Right.
broadens the scope a little bit of what the options may be, depending on the decision being made.
Do you have like a camera in my house or something? I'm
Promise
sitting
you
here
one
like
of the
taking
things that
notes.
helps.
I know, no, it's very true. It's very true. Thank you.
Yeah,
So Jayla, I feel we covered a lot of this already, but yeah, um, I wasn't sure maybe there were some other tips or, advice that you typically give to caregivers who are supporting loved ones, maybe that we haven't talked about already, right? That whenever they're going through kidney cancer diagnosis, what are some maybe
sure.
other things that, you offer to caregivers to consider?
Absolutely. Tips oftentimes when you hear and read about or the initial, even what we've discussed so far, the tips tend to deal with and relate to the caregiver and the patient. And then
Right.
I like to turn the page and say, now for the caregiver solely, write your list of what do you enjoy? We were talking about filling your cup. I tell them, I say your cup is always either half full or half empty. There's always a right answer, and it may be different every time.
Mhm.
If you're constantly pouring out of that cup and never pouring back into it, it's half empty. And if you don't start pouring back into it, it will become empty. And there's nothing, you have nothing left to give. You lose the compassion, you lose the ability to objectively look at your caregiver, your loved one's care needs and situation. And every new piece of information, positive or negative, feels like that much more of a gut punch. So I like to take the the tips in two directions: the tips for the caregiver specifically as it relates to the patient, but then totally separate, talking to the individual, reminding them that they were an individual first. And even though as mom, all the hats we wear, mom, wife, cook, husband, brother, sister, whatever the roles that we have, you still are an individual. So
Right.
what fills your cup? Do you take 5 minutes to yourself? Whether that means, I've had some people say, I may get in the shower and that's where I kind of cry and release because I don't want him to see me
Mhm.
upset. Okay, and if that's helpful both for you and him, great. But there are times when you two do where I do say it's appropriate and okay to sit together and express and emote and share those feelings.
Right.
Friend circles, where are your friend circles? Do you ever get to step away and go out and have, drinks or dinner with a loved one? Church events, different, what things truly fill your cup? Not other responsibilities, not other duties different from that caregiver role, but truly journaling. The adult coloring books are phenomenal. Like, I have so many people that tell me, I had no idea that would make me feel so good. I'm like, go buy some paint and just splatter a canvas. Like, it doesn't even have to have purpose initially, but I promise you, sometimes it will evolve into something.
Yeah.
Play-Doh, clay, golf, like whatever it is that
Mhm.
gives them just a moment away to step away and not feeling guilty for it. You
Right.
need it. It's necessary. And you've got to be able to give yourself permission to do that. So for caregivers, self-care, 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 making your own doctor's appointments, making sure you realize how much time has passed since you've seen your own providers and things of that nature. So
That's
self-care, I can't preach that enough.
That's excellent advice, and I think it's so important, especially because, one thing that I hear patients and caregivers alike talk about pretty frequently is there tends to be a ton of support in the beginning, right? Everybody is, I'm praying for you, you're getting flowers and food dropped off all the time, right?
Right.
And one of the hardest things for me in the beginning as a patient was to realize this is a marathon. This isn't a sprint, right? This is a long term, this isn't just, well, for some patients it is surgery and then done,
Sure.
although I don't know that you
And
ever have
done. Yep.
done, right?
Right.
But
Right.
so how, as a caregiver, what do you kind of recommend to caregivers who are struggling with the void that a lot of times does happen as people move on with their lives and they don't realize, hey, I'm still in the mud, I'm still in the trenches, with my patient trying to help us get through this.
And this is where I really encourage caregivers and families in the early phases to not push away help.
Mhm.
Because people, you ever hear the phrase, check on your strong friend.
Right.
Because part of what that is some of us are so gung-ho and determined in the beginning that we got this, I'm going to do it. And it's not a change in that commitment level. It's just you don't know what you don't know until you're in it. And sometimes caregivers can find themselves, as you mentioned, a few weeks or even a few months down the road. And because they've been so busy and so consumed with their loved one's care and appointments and needs it, they haven't seen friends of theirs and kept up with their social circles, gone out to play pickleball, taken a road trip or just a drive for an hour and just listen to music, like whatever that needs to be. They haven't done that. And because of that change in routine, it doesn't take long before your friend groups go on without you. And it's not because they don't miss you and what have you. They believe they're giving you space because that's what they felt, or the impression that started earlier on. So somewhere in there, the advice there would be, one, in the beginning, try not to sever or isolate yourself in the beginning. It can feel very busy, and even if it's just for a few minutes, or girl chat over the phone, or guys stopping by the buddy's house, garage, I'd say golf, whatever that may be, a walk, the park, whatever it is, not trying not to isolate in the beginning. However, if everything just moves so fast and you find that you're feeling isolated, that's where you reach out to those friend groups and say, hey, Thursday, what, can we meet up for lunch? Don't be afraid to ever initiate either, because setting boundaries and being open to re-engaging friends and people, catching up on what's going on in their lives, but also having the freedom to own. You may find, yeah, some people say, but I just don't know emotionally if I'm ready for that, or if I get out, people start asking questions. You can make rules. Hey guys, I need to step away from all of this. So can we just go hang out and for at least for tonight, not talk about appointments or any of that. And that can be an agreed upon rule. That way you don't spend that hour or two away from your loved one talking about the loved one, unless again you find yourself needing that outlet. But in general, you spend so much time catching everybody else up on the appointments and this and the doctor said that really you've missed that opportunity to just be you again and not be consumed with all of the things that are still going on around you.
That's excellent advice. And I couldn't agree more. And I think
Yeah.
I think it's a good reminder, even for those of us that are further along as patients and caregivers, that
Uh-huh.
we still need to remind ourselves of that.
Yeah.
Jayla, one question I had that, again, I hear a lot from a lot of patients and caregivers is, it is overwhelming for most people to get a diagnosis like this, and their experience in the healthcare system may be minimal. There's a lot of terms that are being thrown around that they don't always understand. Also, quite frankly, right, they may not have had a great experience, to say the least, with healthcare prior to this, right? I know I was misdiagnosed and dismissed for years. And I had a lot of privilege, quite frankly, walking into the situation, right? So it's even harder for patients that, have had negative connotations and experiences with healthcare prior to a diagnosis like this.
Right.
What are some of your recommendations to patients that and caregivers specifically that have this intimidation and overwhelming feeling that they have dealing in this healthcare system?
So first, I do want to acknowledge, and you spoke to it briefly earlier, and this I think is an appropriate time to bring it back up. One of the things that I just don't like kidney cancer specifically, is that it's one of the sneaky, quiet cancers.
Right.
More times than not, patients are found, this disease is found by chance, either because a scan for something totally unrelated found the mass or what have you. Symptoms can mimic so many other things. UTIs can be common for so many other reasons. Blood can be in the urine for so many different reasons. And if there are certain symptoms or things that are reported. And actually, even when I've talked with patients of ours or families, I've had patients say, oh, I helped my daughter move into college and I just thought my back pain was because I lifted and pulled so much stuff. And 2 weeks later, it wasn't getting any better. And then other things started happening as well. And that's when further studies were done. But even in your case, when you talk about how for years, the misdiagnosis. It's so common for cancer, for kidney cancer especially. God gifted us with two kidneys, so the body compensates for quite some time before true symptoms that narrow down that focus to the cancer diagnosis. So that in and of itself can lead to mistrust for a loved one or a family member who's been diagnosed, because a lot of times it's then found at a later stage, which means a lot of the treatment options are either less effective or may not even be options. If there's spreading of disease, surgery may not be then recommended. And so a more aggressive chemo regimen may be recommended, or the immunotherapy recommended. So many pieces change because that disease diagnosis is coming so much later because of these more pronounced symptoms that then say, okay, this is something more serious. Um, so that's the first part. I always like to acknowledge that simply because I never want patients to feel and families to feel like it was an intentional omission. It literally is a disease that mimics so many other things until it narrows. But then the flip side of that is, I also find it equally important to, along the way, when you have your primary care physician or any provider that you are seeing, when you voice a concern, if you feel like they listened to you and they took what you said to heart and gave you valuable information or addressed the concern, that's huge. Whereas there are some providers that I too have experienced, but even with family and friends and different things, they were met with quite the opposite, where it was very dismissive and, oh, that's nothing, don't worry about it, and no workup or no recommendations or nothing was followed up on. And my first reaction or response there, whether we're talking cancer or even a primary care provider, is get a second opinion or find you a different provider, because regardless of a serious disease such as cancer or just your regular primary provider, you never should feel as though you aren't being heard and that your concerns aren't being addressed. That should always be the first and most important thing, because your health is your wealth. Everything about your life is tied to how your physical body is functioning and operating in order for every other area of your life to be what it is what you want it to be, or what you and your family are looking to do, and adjustments and things will happen and come. But you need information. You didn't go to medical school to learn all these things. So that is where you want to know that your provider is listening to you. And I think in most cases where there's a misdiagnosis, I've heard families and patients say, "Oh no, but when we talked about this earlier, he explained to me that it could have been this or that, and we really thought it was this." And they feel more of a peace, even in the misdiagnosis, when that communication has been open and or followed. Because again, this is a sneaky cancer. I've had patients have scans that showed absolutely nothing, and we repeated the scan in 3 months, and it was everywhere. And so this just and it can be a very slow growing disease, or it can be a very rapid disease. There's different types of cancer cells in and of themselves. There's different types of cancer, renal cancers. Some are more aggressive than others. So again, just addressing that mistrust from a standpoint of how much of the attention from your concerns, your things that you're expressing to your provider are being taken seriously and under counsel. Are they talking to you about what that may mean and what some potential next steps would be if one thing was tried or evaluated and not helpful?
Yeah, I'm really glad that you touched on that, because I know for a lot of patients and caregivers, you know, they have spent years and many times, waiting for a diagnosis like this. And then now you're having to put your trust and faith back into a medical system that, you may have had frustrations with, to say the least, beforehand. And so, I think that's really great advice that you've given, because, you know, um, it is a sneaky disease, right? It is something, and I
It
see it all
is.
the time, as I know that you do too, right? Where, I mean, I was 29 when I was diagnosed, and that's not
Wow.
common, right?
Right.
Right?
Right.
I mean, nobody was thinking the 29-year-old in the ER with back pain
Correct.
has
It's
a
cancer.
stage 4 cancer, right? So,
Right. Right.
yeah, I think that
Absolutely.
that's really fantastic points, and I appreciate that. I want to shift gears a little bit. I know that your focus is on palliative care
Mhm.
currently, and I know there's a lot of misconceptions around palliative care versus hospice care. People get nervous when we talk about palliative care as patients and caregivers. So if you don't mind, I'm going to let you explain the difference, because you will do it so much better and more eloquently than I will.
So, absolutely. Well, and I always tell people I stumbled into hospice and palliative care, and it couldn't have come at a better time. So my early nursing career, I was an ER ICU trauma trauma baby nurse who just, the thrill of and the excitement of being able to treat and fix was like, yes, the high five. Oh, that was a hard case, but we stuck in there and that patient survived. And it was all of that, our attention and all of our learning, whether you're a nurse practitioner, a nurse, a physician, everything that we go to school to study is about how to fix.
Mhm.
There really aren't any courses or anything that teaches you what to do when you can't fix, or when the thing that you've suggested, the patient or family goes, that's I'm not willing to go down that route. And so through my trauma and ICU phase of my career, that's when I would meet these hospice nurses that would be coming in, and I'm going, gosh, who are they going to see? And I'd sometimes even find out that a patient in one of the rooms in the ICU is a patient that's been there for 2 months, and we've put them on all the machines and and we've not been able to reverse whatever was going on with their body. The body was continuing to fail, and so that was what made me look and go, so then what is that study? And that's what led me to study palliative medicine, where palliative medicine is not so much about the death and dying, but the more complex multi-system or chronic system failures that all kind of can collide or occur at the same time. And whether it was started because of a trauma or cancer, just chronic disease, these systems are reliant upon each other. And when they fail, the other systems either compensate and help the body recover and do better, yay, or the body continues to weaken and the other systems go, gosh, I don't have what I need and I can't help either. And so when you're looking from and learning about palliative care then is talking about those more complex system needs that aren't curative, because no matter what medicine or machine we put you on, those medicines and machines are intended to help the body recover and then say, okay, now I got it and can do this on my own, meaning the body has recovered. But when the body does not recover and the systems can't function on their own, this is someone that we know in a matter of maybe weeks or months, and in some more acute cases, a matter of hours or days. This is someone who their body, those systems are going to continue to fail, and this patient will enter that dying process. So palliative care in and of itself is not so much the terminal phase of care, it's the more complex chronic disease nature that the body experiences when one or multiple systems are chronically ill and or in earlier stages of failure. Hospice then, though, is when this same body, and again, regardless of or independent solely of diagnoses, but the body is actually entering what is predicted to be the last 6 months or less of life. And so that's when palliative tends to shift then to hospice care, which is the terminal phase of care. And that doesn't mean then that there's anything done to, because people always think that means somebody's going to give them a medication or something to expedite the death, or they're going to give them morphine and morphine causes the death. And that is actually quite frankly not the case. It's a misconception. But palliative care is that more chronic, complex care management. Symptoms are related in most cases, shortness of breath, pain, but these individuals are usually still fairly functional, some still working and leading an otherwise normal life. Many you wouldn't even know had these ailments if you didn't have copies of their records, because they're still otherwise functional. But there's a lot of things going on internally. And then hospice being that more predictive 6 months or less part of the care, where over time we've been able to identify that when certain sequences or start to occur with multi-systems failing, then we know that this time is drawing near. So hopefully that kind of makes a little more sense in that way.
It absolutely did. And I honestly thought I knew a lot about palliative and hospice, and I learned some, so thank you. Um, I think you brought up some excellent points about just, you know, as a patient advocate, and I work with a lot of patients and caregivers in my own time, and I'm not a medical professional like you are. But I always encourage, especially the stage 4 patients, to involve palliative early on, because these treatments are so harsh. I mean, let's just be honest,
Sure.
they are harsh drugs, and they can do miracles, but they are
Correct.
tough drugs. And there's that hesitation of, oh, I don't want to get palliative involved, right? What
Right.
are some common, things that you
any pushbacks that you see from kidney cancer patients, or, things that you say, hey, if you just talk to someone in palliative care about this, we could help you with either the side effect management or other issues that come up, to your point, with the body holistically as you're going through treatment?
So the irony there is, I think with some of kind of the scenario you're giving there, I think some of the common things that we hear when patients are, again, not at end of life, so they still are, again, very functional, newly diagnosed, maybe, depending on staging. There may be a lot of just decisions and treatment, a lot of conversations to have. So the palliative piece, it's a lot of times we have to acknowledge right off the top. I look at body language a lot, and when I'm talking to a patient, if I say palliative or hospice, and you see a shift or you see a face, and I'll say, "Oh, what was that? Tell me what you just heard me say to you." And oftentimes you think I'm dying, or they'll say something very much so. And I said, I thought that may be what you were thinking, because I acknowledge the obvious. I acknowledge the reaction and or the body language, and then I can clarify the intent and why this is appropriate also. Because nope, I don't think you're dying. That is not what we're looking at. And because palliative, much like hospice, but palliative is also a holistic approach to care, then we're talking about not just the physicality and the medications and the side effects. Yes, they are specialists there too, but we're also talking about the emotions they hear. I have some patients who will say, "Yeah, they told me that C word," and they have a hard time even just saying the word. Um, I have some patients who will say, "Don't tell. I don't want anybody to know yet." And then I've got a wife in the waiting room who's going, "So y'all still don't see anything? You don't know anything?" And so sometimes it's getting our palliative and or our chaplains or some of the psychosocial specialists, the social workers, case managers, to kind of to be involved and be an extension of, because it's a full medical team for the patient who could only say the C word and not cancer. That speaks volumes for already what they are eternalizing and already seeing, and sometimes they'll forego treatment or other things because they don't want to accept that word. And I want to make sure that we're not losing opportunities for treatment and or honest conversations in that early phase, or just throughout the care even. So when we hear the hesitation and or the disinterest in hospice or palliative care, the first and one of the most important things to me is to find out where that barrier is. When patients are at end of life, one thing I know for sure is if this patient is dying, that death will occur whether they have hospice on board or not. And part of my biggest fear and greatest concern for the patient and the family is this is coming whether you're ready or not. And what I really want our teams to help you do is I want them to walk this journey with you. I promise you we're not here to do anything to expedite or to cause it, but there's a lot of what ifs that you and your family still need to address. And we want to make sure we help usher those conversations, because that's really where it is. The specialists and the doctors are going to continue the treatments and things that are appropriate. But during the midst of the waiting and the in-between times, there's conversations and decisions that need to continue. And that's where we want to make sure we help bridge that gap. We also want to make sure patients and families are really good advocates for themselves, and that there are questions that they jot down and that they ask. And when the doctor is speaking, if he's pronouncing words and saying things that just are not registering, then it's okay to be able to say, "Now tell me more about, I'm emaciated. What does that word mean?" Or, because medical jargon is common in the medical community, and sometimes we can roll it off really quickly and easily, but we have to also sometimes be mindful that no, say all the words, make it plain. And yes, that'll make me ask more questions, but I need to ask these questions. It's important that we're transparent.
You touched on so many things that I really hope that our listeners take home and absorb, because one of the things that my mom unfortunately didn't get the opportunity to do hospice. I say opportunity because I really do think hospice is a gift, quite frankly, right? No one wants to be in that position, but it is, we're all going to die one day, right.
Yeah.
And so and I've seen hospice do amazing things with other loved ones in my life, and and with friends, and I know that it really can be a gift. but I know it's just such a tough conversation, both from the patient side
Absolutely.
and the caregiver side, right? And usually the two are not aligned. When somebody wants to talk about it, the other one doesn't, right? How do you navigate that? How does a patient or a caregiver navigate that conversation of, if it's time to be discussing hospice, what do you do?
Right. Right. So just for communication in general, we this in one of our recent sessions, because we every now and then we will have a husband and wife or a patient and caregiver on the caregiver pull up a chair groups, and we welcome that. But we always like to make sure that caregiver group is a place that the caregiver can truly come, and whether they want to talk about the loved one and the care and some of the things that are stressing them out. Or some of the victories, even, because we do get those as well. We've got a couple of folks that we can't wait for them to check in on our next one. One is they're on a cruise. Another, they were able to go do a trip that they had been planning and talking about for a while. So we love to hear those things too. Um, but communication can be hard across the board. We had one gentleman who was very stoic, and his wife acknowledged he's very stoic. We've tried a couple times to have these conversations, and it didn't go over well. So we just had to leave it because we didn't want to both be frustrated with each other. And so sometimes it's not so much the verbal communication right away. As a teenager, I was sharing with them, I said, as a teenager, when I went through my testy years, and I don't know what gave my mom this insight, maybe she just was praying to the good Lord above, but she would write me letters and let me know she was disappointed or whatever our disagreement was. She'd write her side, and then she'd say at the end of it, she'd of course share her love and everything else, but then she'll say, and I'm not going to speak to you until you write me back. Writing has a way for us to not only express and get things off of our chest, but by the time pen hits paper, more times than not, either your emotion has changed and you've heard yourself in a different way, or you're able to read back what you wrote and go, "Gosh, that sounds really harsh," or "I'm glad I was able to get that off. I never thought I'd be able to be so honest in that way." So one of the assignments, that's why I think journaling is great for caregivers and patients alike, but specific to how to get conversations going, I recommend I tell this to friends of mine with teenagers because again, my mom and my experience early on, but across the board, difficult conversations can be had simply by initiating writing. So what I say is, if you and your loved one have two receptacles, two little bins or something to put cards, like little index cards. Both of you, one has your name, one has the other person. You can have one for every family member if needed. But what you're going to do with those is you're going to have those cards available so that you and your loved one can write questions to each other. So it could be something as simple as one of the caregivers on the call said, "I don't even know the passwords to stuff in the house. Like if anything were to happen right now, like that would be one of the first things." And I said, so then in his receptacle, and you write on one side of the card, what's the password to the Wi-Fi, or what's what would you want your family to know if something happens, or do you feel like you've said everything to us, or you can be very specific with questions, and then you drop it in that person's receptacle, and they have the freedom and the option to respond to it right away. They flip the card over and they write their answer on the other side. They put it back in your receptacle, so you both are checking your receptacles and at least getting some key things that don't require you to confront each other face to face quite yet, but it at least allows you to ask very specific questions, simple little questions, and little memory making things. And again, not everything is just about when you're gone. It literally can be, I know you were frustrated with me the other day. I was frustrated with you. Name 3 dinners that you would want me to make, because it's that whole, who's cooking dinner? Are you cooking dinner? I'm too tired. It can be anything that can spark frustration, and it can come out in different ways. So being able to do that was one that was not only well received, but that I know friends of mine, and we've used those opportunities in different ways. And so I think that's a helpful one for people to take advantage of, is writing. And that usually will get the conversations going across, gosh, many topics and decisions that have to be made. If your doctor gives us this kind of news on this scan, Are you interested in doing further treatment, or would you want to do something else? Do you want to do, you know, do you want to forego that? Do you like what's most important to you? And that way it can start some of those conversations. What will make your decision to do it again versus not? All of those conversations just to, and again, they just write their answer on the flip side of the card and they put it back in your box. And once you've done that a few times, it will sometimes open that window to say, can we sit down and talk about 2 of our cards or 3 of our cards based on the answers that were given?
Your mom was ahead of her time.
I guess she
Um,
said, we gotta live, look, we gotta live together. I guess maybe that's the
yeah,
way to go.
right. Well, it's
But she
funny.
did. It drove me nuts, but it was effective because she would not talk to me until I wrote a letter back to her. That was not my intent. When I said this, I didn't mean that. I was talking about that. And
Right.
you took it the wrong way. I was talking to, we really,
Yeah.
and it would be a misunderstanding in most cases because I promise I was not a bad kid, but
I
I was a little
believe that.
mouthy. Look, I was a little mouthy, but it was not, yeah, the intention got lost. So
Yeah.
yeah, that helped keep us on track and
Yeah.
it worked beautifully. Yeah.
It reminded me, I had honestly kind of forgotten about this, but I remember my youngest was younger and it was a mother child journal that I picked up at like Barnes and Noble or
Oh.
something. And so kind of similar, we had question
Mhm.
prompts and would pass it back and forth. So yeah, that was really helpful. Jayla, we could talk all day long. I have like so many questions that I'm just dying to ask you, but I want to be respectful of your time. You know, uh, if people want caregivers, to your point specifically, want to join, pull up a chair, how do they do that? What's the cadence of your meetings?
Yes, 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 yes. I definitely be my special guest. I say be my guest. I would love to see you at our where we come together and informally connect. We do this every Thursday, the last Thursday of every month, Thursday of every month, 7:30 to 8:30 Eastern Standard Time. And to join us, you simply go to the easiest way is to go to our Judy Nicholson Facebook page. You'll see the links there, and you can register for just one. You can register for all. They're free to all of our participants. We just like to have the registration so we can anticipate the needs, but also it gives us a way to connect with you and maybe follow up from time to time. I promise you, we won't blow up your phone or your email and send you things that aren't helpful. But also, you'll find a wealth of information on the Judy Nicholson Facebook page. You can also go to jnfkidneycancer.org. You'll find our links for those registrations for the pull up a chair sessions, as well as other symposiums and things that we have coming up, as well as those that we've done in the past. So, a wealth of information directed to both patient and then patient and family. So, and caregivers alike. So, please check us out. And we look forward to seeing you. I'd be most happy to have you join us for our Pull Up a Chair Caregivers Connect.
Well, thank you. I'm definitely going to take you up on that. And
That'll do it, please.
I will, and I really encourage our listeners to as well, because I think that, whether you're new to caregiving as a kidney cancer or more experienced, there's still a lot to unpack, a lot to uncover, and a lot to learn, and just a wealth of information that we have with Jayla. And so
Right.
really appreciate all that you do for the foundation and for patients and caregivers within the community.
Absolutely, and caregivers get to glean from each other. I think that's also what you'll see and hear most often. While I may be, there to moderate and be a support, it really is great to be able to talk with people who are either going through the same journey as you, coming out on the other end of it, and can share things that were helpful for them, or frightened and at the very beginning of it all and trying to figure it all and make heads or tails of what is to come. To have that support and these other caregivers to be able to love on each other, because that truly is what that's about. Join us. We'd love to see you there.
Thank you. Thank you so much, Jayla
Right.
Barnes. This has been an absolute pleasure. Thank you so much for all that you do for us. Again, I really encourage our listeners to take advantage of the free opportunities and support that the Judy Nicholson Foundation provides, including wonderful, talks like Jayla's. So thank you so much. And any
Thank you.
last words, any parting thoughts for our audience today?
Oh gosh, I can't think of anything other than to say, remember to take care of you. For this,
Okay.
that to my caregivers, both patients alike, but caregivers, remember to take care of you. Fill your cup, and that way you'll be able to do the same for others around you.
That's all, folks. That's all. I mean, what better way to end it than that? Thank you so much again to you.
Absolutely.
Thank you. And
Absolutely.
thank you again to the Judy Nicholson Foundation for sponsoring this podcast. Thank you to our sponsors, Alexis, Merck, and Ibsen, and we'll be back next month. So thank you all. I'm your host, Laura Esfeller. We'll see you on the flip side.